The country's coronavirus tally has surpassed the 7,000 mark after another 247 people tested positive for COVID-19. This coming amid admission by the Ministry of Health that the number of Kenyans exposed to the virus could be high. Ministry officials, however, maintain that the study by the Kenya Medical Research Institute on antibodies showing 2.6 million Kenyans might be affected is based on a small sample collected from blood banks across the country and therefore remains inconclusive. Nancy Okware with more details.
For the better part of Friday, the social media platforms were abuzz with Kenyans expressing concern as details of a study conducted by the Kenya Medical Research Institute emerged. A scary report revealing that close to 2.6 million Kenyans might have been exposed to coronavirus. These would form basis of Friday's COVID-19 update as the Ministry of Health took the opportunity to clear the air on the matter.
And we collected samples from these 6 regional centers, blood representing, most parts of the country. These blood samples were then tested against that test to determine how many of them actually had antibody and how many were negative, including county of Mombasa, county of Nairobi, and a couple of other counties. We are able to determine the percent prevalence. In other words, in every 100 people in that county, how many actually have this antibody.
And if the preliminary antibody test findings are anything to go by, then Nairobi County has approximately 500,000 people who might have been exposed to the coronavirus.
For instance, in Nairobi, we found that almost over 12% of the population of Nairobi seem to have been exposed to this virus. Remember, we are using a small sample and then extrapolating.
KEMRI, however, says that more analysis is ongoing as the test was conducted on a small sample size and may not constitute the actual representation of the Kenyan population.
Blood donors are not 100% representative of the population. We know, for instance, that the people that donate blood are younger than the general population, and so on and so forth. So these are indicators. When you check for antibodies in someone's body, you're not checking for whether that person is infected now. You're checking for whether that person has been exposed in the past.
The development comes as 247 people tested positive for coronavirus, bringing the total number of confirmed cases to 7,188. Nairobi yet again recorded the highest number of cases, standing at 153, followed by Mombasa with 35 cases, Kajiado 15, Busia 12, while Kiambu had 12 cases. Additionally, the number of recoveries rose to 2,148 after 39 more people were discharged, with 2 more people succumbing to the virus.
As of today, our case fatality rate is 2.29%. compared to the global average of 6.7, so which is a third. So I want to applaud the healthcare workers for the excellent work they are doing to manage COVID-19 cases.
And with cancer being one of the common pre-existing conditions among coronavirus patients, the Ministry of Health launched the Kenya Cancer Policy 2019-2030 that provides a framework on how to comprehensively manage the cancer burden in Kenya by strengthening quality of routine reporting of all cancer cases, surveillance of cancer, and promotion of research on cancer control. The Breast Health Awareness Campaign report was also launched following a pilot conducted in Nyeri. Nancy Okware, Channel 1 News.